Hello and welcome. Thank you for joining me. My name is Janelle Mirzai. I am the Healthcare Facilitator at UCSB, and this presentation I will provide a high-level comparison of the UC Medical Plan options for the 2023 plan year. This presentation is intended for communication purposes only. Please visit the UCNet website and plan documents for complete information. Resources. Alex is a personal benefits counselor available 24/7 on your computer, phone, or tablet. Alex gets to know you and understand your healthcare needs and offers guidance on finding you a plan that suits you best. Alex is available in Spanish and English. Accolade is a new vendor to assist Anthem members with referrals, claims resolution, second opinions, and authorizations, just to name a few. Accolade will be available 24/7. Some other great resources include the open enrollment website as well as UCNet. Another great resource is the open enrollment brochure, which you can find on the open enrollment website and UCNet. Most of the content I cover in this video will be found in the Which Medical Plan is Right for You booklet. All the same medical plans will continue in 2023. Topics: plan enhancements, rates, priorities, residence limitation, choice of physician, quick medical plan descriptions, cost of care and prescription drugs, out-of-pocket maximum, health saving account, HSA, behavioral health, chiropractic and acupuncture, living out of country, and resources. New for 2023 PPO plans, Accolade will replace Anthem Health Guides. Accolade will have a new UC dedicated phone number, mobile app, member portal, offer virtual medical care, questions, psychology care, second opinions, clinical support, referrals, authorization, and cost of services. UCHealthPlans.com is to replace UCPPOplans.com. New 2023 enhancements for UC Care, Core, and Health Savings Plan are enhanced infertility benefits, which include artificial insemination, IVF, GIFT, ZIFT at 50% coinsurance up to 2 lifetime cycles. For HealthNet Blue and Gold, enhanced infertility benefits such as IVF, GIFT, and ZIFT will be covered at 50% coinsurance up to 2 lifetime cycles. Adult immunizations can be obtained at the office visit or HealthNet contracted pharmacy at $0 copay. Does not include children vaccines. For Kaiser, enhanced infertility benefits for IVF, GIFT, and ZIFT will be covered at 50% coinsurance up to 2 lifetime limits. Ginger, a 24/7 emotional support coaching app, will be available. Breastfeeding supplies and location support at no charge. SelectKP.org will replace MyKP.org. Here is the new chart for the 2023 employee contributions. This chart will provide you the deductions that's based on your pay band. Your 2023 medical contribution is based on the salary as of January 2022. These deductions are pre-tax contributions. Getting started. Each of the UC medical plans offers similar coverage. Additionally, all the plans cover preventive care at no cost when you use in-network providers. There are residence limitations depending on what plan you elect. So here's something to keep in mind. For the UC Blue and Gold and Kaiser HMO plans, the employee must live in California and have your primary care physician or medical group that must be 30 miles of where you live or work. For the health savings plan, the employee must live in the U.S., whereas the UC Care PPO and Core plan, the employee may live anywhere and offers worldwide services. One of the first ways of finding the plan that best meets your needs is understanding your priorities. Is your priority the cost to be enrolled in a plan, choice of providers, or effort to manage the plan, like coordinating care and bills? Your choice of physician will vary depending on which plan you elect. Under the HMO plans, you assign yourself to a primary care physician medical group. Your PCP medical group coordinates your care and refers you to a specialist who are contracted with your medical group. Out-of-network coverage is not available under the HMO plans. Under the UC Care PPO, Anthem is your preferred provider. Under this plan, you have access to the UC Select and Anthem preferred providers as well as out-of-network providers. Under the Health Savings and Core, Anthem is also your preferred in-network provider, and you have access to out-of-network providers. Let's take a closer look at our medical plans. Terminology. UC HMOs do not have deductibles. A copay is a fixed rate for each service. UC PPOs have deductibles and coinsurance. Deductibles is the amount you pay each year before the plan starts sharing the cost. Coinsurance is your share of the cost after you pay the deductible. Your costs are based on the network the provider is in and the service you receive. You pay discounted rates for in-network providers. You pay more for out-of-network providers. For the UC Blue and Gold plan, there is a large provider network available across California, no deductible and low out-of-pocket maximums, health coaches, 24-hour nurse line case managers, CVS Minute Clinics, $20 visits, UC dedicated customer service line. Most specialty care must be referred by PCP. Referrals and prior authorizations usually required. Must use your medical group's network of specialists, hospitals, and labs. May need to get permission from PCP's office before using urgent care centers. Our other HMO plan, Kaiser, it offers the Kaiser Foundation health plan contracts with one large group, the Permanente Medical Group. Clinics tend to offer pharmacies, imaging, laboratories, urgent care centers, all at one location. Classes, pamphlets, and videos on a wide variety of health topics, online weight, stress management, and nutrition programs. No cost access to wellness coaches by phone, Calm and My Strength behavioral health tools. Limitations. Members must visit Kaiser Pharmacy providers and hospitals only. Available in most urban California. UC Health Saving Plan provides low premium, high deductible PPO with an HSA, health savings account. HSA partially funded by UC, pay for medical expenses with HSA Smart Card or website. HSA not use it or lose it like the FSA. HSA has a triple federal tax advantage. Pay no taxes on contributions, earnings, withdrawals for healthcare expenses, California taxes, contribution, and earnings. In 2023, you can contribute pre-tax up to single $3,850, family $7,750, and $1,000 if you're over age 55. For our core plan, no monthly premium, one deductible out-of-pocket limit, whether in or out of network, no PCP, self-refer to specialists, large national preferred network, out-of-network and worldwide coverage, live health online 24/7 telemedicine, high deductible per person and per family, high out-of-pocket limit per person and family, out-of-network coverage severely limited, no coverage for hearing aids. For our UC Care PPO plan, it provides care from UC Select providers for low copays, lower deductibles than core UC Health Savings plans, lower copays for pharmacy versus core health savings plan, lower copayments for mental health compared to core, no PCP self-refer to medical providers, large national preferred provider network, out-of-network coverage, worldwide coverage at Anthem preferred level of benefits, has 3-tier option for network care, UC Select, Anthem preferred, and out-of-network providers. Disadvantage: patients don't know their out-of-pocket expenses in advance. More expensive to use than HMOs, members must keep track of their medical bills. Out-of-network providers can be very expensive. Let's take a moment to look into the 3 tiers more closely. UC Select Tier 1 and Anthem, Preferred Tier 2 are going to be your in-network providers. Your UC Select Tier 1 providers are UC medical centers and select Anthem preferred providers who are contracted under the UC Select Tier 1. For Anthem Preferred Tier 2, that's going to be your Anthem preferred providers. If you're outside of California, it will be your Blue Cross Blue Shield providers. If you're outside of the US, it will be called Global Core. Then, of course, you have Tier 3, is any provider that is not contracted, and they will be out of network. UC Select in Santa Barbara is limited to Samsung Clinic, Cottage Hospital System, Quest Diagnostics Lab, Pacific Diagnostics Labs, Quebro Radiology. Search Anthem directory for local UC Select providers. Click the recognitions icon to identify UC Select providers. As I mentioned in the previous slides, there are additional UC Select Tier 1 providers locally in the Santa Barbara and Ventura counties. You can search for those providers via Anthem directory online or contacting Accolade. Under the PPO plans, the plan negotiates allowed rates to process claims. The discounted rate is the amount each plan negotiates with preferred or participating providers. You pay the in-network coinsurance on the discounted rate, and the provider cannot balance bill. When using out-of-network providers, Anthem assigns allowed rates to process claims. When a provider is out of network, they are subject to the discounted in-network rate. Anthem will pay at the out-of-network coinsurance on the assigned amount, and the provider can balance bill you the difference. Each of the UC medical plans have an out-of-pocket maximum, which helps limit your financial liability per year. This means that if you or someone in your family experienced a catastrophic event, you are not slammed with a $100,000 bill at the end of the year. The out-of-pocket maximum is the maximum amount a plan requires an individual or family to pay in a calendar year before the plan pays 100%. The out-of-pocket maximum includes co-pays, deductibles, co-insurance for medical services, behavioral health, and prescription medication. The table on the right shows the individual and family out-of-pocket maximum for each plan for the 2023 plan year. Let's take a closer look at the out-of-pocket maximum for HMO plans for HealthNet and Kaiser. As you can see from the chart, the HealthNet HMO out-of-pocket maximum for an individual is $1,000, whereas a family of 3 or more is $3,000. For Kaiser plan, the individual out-of-pocket maximum is $1,500, whereas for a family of 2 or more is $3,000. Again, once you meet this out-of-pocket max in the plan year, the insurance will pay 100% for the remainder of the year. Let's take a closer look at the UC Care PPO plan. UC Care, again, has 3 tiers: UC Select, Anthem Preferred, and Out-of-Network. Each of these tiers has their own out-of-pocket maximum, and the UC Select and Anthem Preferred out-of-pocket maximum do not cross-accumulate, whereas the out-of-networks don't accumulate and it's completely separate. The medical, behavioral health, and pharmacy benefits are combined, and the UC Select and Anthem Preferred pharmacy and behavioral health benefits will accumulate towards the out-of-pocket maximum. Let's take a look at the out-of-pocket maximum for Health Savings Plan and Core. For the health savings plan, you can see two out-of-pocket maximums that must be met when you are using Anthem Preferred or out-of-network providers. For Anthem Preferred providers, the individual out-of-pocket maximum is $4,000 and the family out-of-pocket maximum is $6,400. When you are using out-of-network providers, the individual out-of-pocket maximum is $8,000 and the family out-of-pocket maximum is $16,000. For core, the out-of-pocket maximum for both Anthem Preferred and out-of-network providers is $6,350 for individual and $12,700 for family. Again, your medical, behavioral health, and pharmacy are combined in the out-of-pocket maximums. In-network expenses apply to out-of-network deductibles. Full-time out-of-pocket maximum must be met before the plan pays 100% for any family member. Here is another example of how the deductible works with the health savings plan. You pay the $1,500 individual deductible first before Anthem starts sharing the cost. After you meet the deductible, you only pay 20% of the cost. After you meet the out-of-pocket maximum, Anthem pays 100%. Your deductible applies towards the out-of-pocket maximum. The UC Health Savings Plan is a high deductible plan paired with a health savings account. This is the only UC medical plan that meets the IRS requirements for the health savings account. That said, the health savings plan is a two-part plan that the medical component is administered by Anthem Blue Cross and the health savings account component is administered by Health Equity. There are many advantages to having a health savings account. With the health savings account, you keep the money even if you change jobs or insurance plans. You can make contributions at any time. You can increase or decrease your contributions throughout the year and have HSA triple tax advantage. No federal taxes on contributions, no taxes when funds are used, no taxes on earnings. HSA funds roll over from year to year. You can invest funds to earn more. Before enrolling in the health savings plan, there are some things you need to consider in order to own and contribute to the health savings account. First, you cannot be enrolled in Medicare Part A or B. Second, you cannot be enrolled in any other medical plan. Third, you must have a zero balance in your health flexible spending account as of December 31st, 2022. And finally, you cannot be claimed as a dependent on someone else's tax returns. If you're enrolled in the health savings plan, as of January 1st, 2023, the UC will contribute $500 for an individual HSA or $1,000 for a family HSA. You can contribute anytime up to the IRS limit. The 2023 IRS max for an individual is $3,850 and $7,750 for family. Keep in mind that you must account for the UC contribution when calculating your HSA contributions to ensure you do not exceed the IRS limit. Members 55 or older are eligible for a $1,000 catch-up contribution. Comparing our medical plan copays and coinsurance. Let's take a closer look at the office visit. For our HMO plans, UC Blue and Gold and Kaiser, these plans do not have a deductible or coinsurance. Instead, you pay $20 for each office visit. Under UC Select Tier 1 of the UC Care PPO plan, you do not need to meet a deductible and you do not have a coinsurance. Like the HMO plans, you pay $20 copay under UC Select Tier 1 for each office visit. As you can see, the cost breakdown remains the same for hospital and outpatient surgery for our HMO plans. Under the UC Blue and Gold and Kaiser plans, you will pay a copay, a hospital visit, or outpatient surgery. Under the UC Select Tier 1 of the UC Care PPO plan, you will also pay a copay for these services. whereas you must meet your deductible first under the Anthem Preferred Tier 2 and Out-of-Network Tier 3 before Anthem co-shares in the cost of services. You will pay a $125 copay for an emergency room visit under the HMO plans UC Blue and Gold and Kaiser. The $125 copay is waived if you're admitted. Under the UC Care PPO plans Tier 1, 2, and 3, you will pay a $300 copay or $250 copay if admitted. Since core and health savings plans are high deductible PPO plans, you must meet your deductible first before Anthem will co-share in the cost of services. Once your deductible is met, your co-insurance will vary depending on whether the provider is in-network Anthem Preferred provider or out-of-network provider. As a reminder, you will get more bang for your buck when using in-network Anthem Preferred providers. For an emergency room visit, the cost breakdown remains the same for the core and health savings plan, in that you must first meet your deductible first before Anthem begins co-sharing in the cost of services. For the HMO plans UC Blue and Gold and Kaiser, as well as the UC Care PPO plan, you pay a copay for prescriptions. Under the health savings plan and core, you will pay a discounted rate until you've satisfied your deductible. After the deductible has been met, you pay 20% at the preferred pharmacies. Each of our medical plans offer behavioral health coverage, and the medical plan you elect will determine your behavioral health provider. Furthermore, a referral is not required when accessing a behavioral health provider. The in-network behavioral health provider for UC Blue and Gold HMO is managed by Managed Health Network MHN. For Kaiser, you have the option between Optum Behavioral Health or Kaiser Behavioral Health. In this video, I will be focusing on Optum Behavioral Health. And then Anthem is the in-network behavioral provider for our PPO plans, UC Care, Health Savings Plan, and Core. Anthem Behavioral Health has 24/7 nurse line and behavioral health resource centers, a variety of online tools, a mobile app, Sydney Health, Live Health Online, which will provide medical, psychology care, and include psychiatries, and Learn to Live is behavioral health site. Under the HMO plans and Tier 1 and Tier 2 of the UC Care PPO, the cost for the first 3 visits is $0 copay, and then you will pay $20 copay starting at the 4th visit with in-network providers. Under the Health Savings Plan and Core, once your deductible has been met, Anthem pays 80% and you will pay the 20% for in-network providers. You also have specific providers for chiropractic and acupuncture care. American Specialty Health is the chiropractic and acupuncture provider for UC Blue and Gold and Kaiser. This service is self-referred and you are limited to 24 combined visits in a year. Under the UC Care PPO, Anthem is your in-network provider. Chiropractic and acupuncture care is not available at the UC Select Tier 1. However, it is available at the Anthem Preferred Tier 2 and Out-of-Network Tier 3 levels. Like the HMO plans, you are limited to 24 combined visits in a calendar year. Under Core, Anthem is your in-network provider and you pay 20% co-insurance after you've met your deductible. Under Health Savings Plan, Anthem is your in-network provider and you pay 20% co-insurance after you've met your deductible. When traveling outside the U.S. Each of the UC medical plans provide a certain level of coverage when traveling outside the U.S. For our HMO plans, HealthNet and Kaiser, and the Health Savings Plan, you are limited to emergency and urgent care when traveling outside the U.S., whereas UC Care and Core plans offer worldwide coverage. Under the UC Care PPO plan, Anthem can cover outside the U.S. at the Tier 2 Anthem Preferred or Tier 3 out-of-network level, and Anthem can pay at the in-network and out-of-network level for core. I'd like to take a moment to briefly highlight on all the open enrollment resources available to you. The UCNet Open Enrollment website is where you can access the 2023 plan documents and changes. UC Path is where you will need to go to submit your open enrollment changes. If you have general open enrollment or benefit questions, you can submit a ticket through the UCSB HR Service Now portal. Finally, if you can access and view other videos by visiting the UCSB Healthcare Facilitator YouTube channel. Thank you for joining me. If you have any further questions, please open a ServiceNow ticket.